Mental health has been a concern of mine for most of my life. Even when I was a little kid, I was concerned about mental health and mental care treatment. I ended up getting a degree in psychology, and then I went on to nursing school and eventually became a psychiatric nurse and worked in mental health for 17 years. There were two things, though, including my mental health experience, that really profoundly affected me. And one of them was the Columbine shootings. I grew up in Littleton, Colorado, and I knew people who had kids that were in the school during the shooting. I knew people that attended the school after the shootings, and they anecdotally said that suicide was pretty prevalent there. So this was where two adolescents who had mental health issues shot their peers. 12 people died. And also my husband was a photojournalist. He was the second photojournalist on the scene. And he was in a cul-de-sac behind the school where they were bringing the wounded and the dying. And the parents were back there, and they were screaming at him and yelling at him to put down his camera. And I can only imagine their grief and sorrow of such a difficult time, and it still affects me. So fast forward from that time period to my own life, and my daughter, Amy, was diagnosed with cancer. So this is Amy in the picture. She was 7 years old, and she had a bizarre Wilms tumor. And a Wilms tumor is in the kidney. It grew out of her kidney, and she had chemotherapy for 9 months, and then she had radiation. And during that time...
And surgery.
And surgeries. Multiple surgeries. Probably about 9.
So fun.
So she developed anxiety and depression and PTSD. And during that, I experienced a lot of grief. Also, like the parents in Columbine did, the sorrow, the anger, the depression.
My anxiety presented itself shortly after I finished my cancer treatment. I started to experience things like anxiety-induced stomach aches. I would get panic attacks. I would have an inability to focus on anything except what I was worried about. And shortly after that, I started to develop symptoms of depression. So I lost interest in doing the things that I normally liked to do. And one of the biggest things was I lost my appetite. I had to go on an appetite stimulant. And I also had outbursts of anger and irritability. And we really, really had a hard time finding a psychiatrist or therapist that I was compatible with, because finding the right mental health care provider is like finding the right pair of jeans. You have to try a few on, see what works for you, and it's not cheap.
No, it isn't. And lots of times insurance isn't covering it. So when Amy had cancer, we immediately found the best specialist. It took hardly any time at all. But finding a therapist or a psychiatrist took us over 5 years. And I also had a lot of connections in the community. So I would ask people, does this therapist work? Does that therapist work?
So we had some advantages that a lot of people don't, and it was still really hard to find a psychiatrist. And we believe that going to a therapist or psychiatrist should be as easy as going to the doctor when you have a cold or a fever. You should know where to go, who to go to, and when you need to go to see someone, and you shouldn't feel bad about it at all.
Mental health should be treated the same as medical health. So basically, that's the definition of mental health parity. So I've been very concerned about mental health, like I've mentioned. In the United States, 1 out of 6 adolescents has a suicide plan. And in our own state...
Or has had a suicide plan at some point.
Mm-hmm. or has had a suicide plan. And in this state alone, we're the 6th highest state for suicide. This is for adolescents and children. This is double the national rate here in Colorado.
And on top of that, over 37% of adolescents in high school experience feelings of sadness or hopelessness. And of that 37%, only 16.8% receive treatment. That leaves 20.2% with no treatment and unable or unsure of what to do with the way that they're feeling.
So this continues to be an issue in Colorado and in the country. And I was doing my dissertation in nursing, and my dissertation, I decided to do it on parents' perception of mental health and mental health treatment of their adolescent with anxiety and or depression. And I do have to say, my daughter was a little bit of an inspiration for that dissertation.
Yes, I was the cause of that hopelessness and grief.
And so what I went ahead and did, because
she did a whole study about it.
yeah. So I did a qualitative study where I interviewed 18 parents in the Northeast Denver metro area and asked them their perceptions about mental health. And what we learned was that parents would observe their adolescent going through their own journey, and they didn't know if it was normal or abnormal, or if it was a phase, or if they should get treatment.
A lot of the symptoms of anxiety and depression can appear like normal adolescent attitude, or, you know, that fun period of time when you're growing up.
So also pervasive during that time period, because it is a difficult time and you don't know some of the things that are going on, and should you be addressing it. But what the parents saw when they went through and observed their adolescent's journey, all of the parents described stages of grief. So Elizabeth Kubler-Ross in 1969 defined the first 5 stages of grief: denial, anger, bargaining, depression, and acceptance. The parents described that they went through all of these in different ways.
It's important to remember that your experience with having mental health, or with having a relative or a child going through mental health issues, will not look the same as anybody else's. And that's part of the reason why some people feel so alone in their journey with mental health, because everyone is different and experiences things differently.
That's so true. And for example, some parents would describe that they would be bargaining with God. You know, if my daughter or son feels better, you know, I will do this. And different parents express different things. Finally, when they did come to acceptance, that's when they accessed mental health care. And they went on their own journey. So mental health care and mental health treatment is not only a journey for the adolescent, but it's a journey for the parent. And the final and 6th stage of grief, finding meaning, which was defined by David Kessler, who worked with Elizabeth Kubler-Ross he added the 6th stage, finding meaning, which also leads to normalizing mental health care in my mind.
Or it leads to people coming and doing TED Talks like this.
Yeah. And so many times the parents would talk about different things, why they did or didn't get mental health care. There is stigma. They were worried that their adolescent or their teenager would be devalued. They were concerned that they would be discriminated against. Parents who had adolescents that needed mental health care, and they themselves had gotten it, or other family members had gotten it, were more apt to get treatment for their adolescent. So what I found in my dissertation was that it's a complex interplay of 3 systems. There's the family system, where it's the family's perception of mental health treatment and the value of it. There's also the school system. Many times the parents felt that the school system called attention to some problems or issues.
Or they caused the problems and issues, but that's a whole other topic for another day.
Yeah. So once these 3 systems work together, many times a parent would access mental health care. Unfortunately, sometimes it would be through the emergency room because they had such difficulty either getting in to see somebody or mental health care wasn't covered by their insurance. And that's why it's so important that mental health care is treated the same as medical care.
In no universe should someone's mental health issues get to the point where they have to go to the ER because there's nothing left to do. So it's really important to, people should not have to go through the experience of losing themselves and their emotions because they couldn't find the appropriate help.
So what can we do to normalize mental health care and mental health treatment? There's so many different things that we can do. There's education, there's advocacy.
Advocating for yourself. So I'm a big advocate of taking mental health days from school and work and doing so without worrying about what someone is going to think about it. And talking openly about your experiences with mental health is a huge one because it will help you and the people around you feel less alone in what you're going through.
And talking about mental health and mental health care in the workplace is also a way to normalize mental health care. To also be familiar with the legislation going on in our state. Here in Colorado alone, our recent legislator just passed a bill in June of 2021 where adolescents can actually get 3 sessions of mental health care, usually by telehealth, for free. And in January of 2022, insurance will be covering mental health examinations, and the initial one.
And we believe that mental health should be treated, like as we've said, as medical health. So even if we do like yearly checkups on mental health like we do for physical health, and just remember that you're not alone in your struggles and that there are people pulling for you.
We want to ask you, what are you going to do to help normalize mental health treatment? So thank you very much. Wow.